episode 26 of the Treatment Room Secrets podcast. Good to be here with you, John Wilkes. Thank you for being here.
Nice to see you again.
Again, yes. We're here in Frome.
Frome.
And it's in Somerset, correct?
Somerset, as they say here.
Somerset. Yeah, I heard that you guys here have
a bit of an accent.
Funny accent, right? Yeah, a couple people warned me. I also, coincidentally, I'm reading this book. It's called The Black Count.
Really?
It's about a French guy, a soldier who rose to be like a French hero back in the 1700s-ish, I believe.
Right.
I'm in the beginning of the book, but Somerset came up. I don't think Somerset has ever come up before in one of my books. Somerset came up because it said something about this is where the abolitionist movement started in the UK.
I absolutely have no idea about that at all. I'm really sorry.
Yeah, so
it's quite possible.
So it was cool just because I knew I was going to be here in the next a week ago. I was reading this book and Somerset came up, which I thought was pretty cool. But it is beautiful here.
Yeah.
Every time I leave London and spread out into England and Wales, Craig, don't worry, and Southern Wales, it's just so beautiful, so peaceful, so calm. So thanks for giving me an excuse to be here.
No, it's great.
So we spent the last couple of days talking a lot about Bowen therapy. Can we start with just giving a brief intro to what it is? For the person that doesn't know anything about it, we have this little book here, which I think gives the good synopsis of what Bowen is. What is it? I know it. I knew this before, so listening to you speak for the last 48 hours, originated from the man named Bowen from Australia, right?
Yeah, I mean, the name originates from his name, which is Tom Bowen. And he was from Geelong, which is just outside Melbourne, about an hour from Melbourne in Australia.
Yeah.
And I mean, his history was quite interesting. His family were actually from the Midlands, Wolverhampton area. And I think they emigrated to Australia when Tom Bowen was really quite young, like, I don't know, in his 4 or 5 or something like that, very, very young. And they were kind of manual labourers, really. I think his dad was, and certainly Tom Bowen was as well. He worked in the cement works, and was obviously very, very interested in manual therapies and particularly sort of getting people out of pain, really. So he was largely, actually pretty much completely self-taught.
But was it because of his work environment? Was he seeing people around him?
Yeah, I think he was seeing people who were injured and, at work and things like that. And he just wanted to help them, I think. So, but we don't really know because he didn't really talk about it much. I mean, he wasn't a particularly good communicator. And I think this is one of the issues with Bowen, that actually he was a very intuitive guy, clearly, who could kind of read the body in quite magical ways that I'm certainly not capable of doing. He could look at someone and say, "Oh, when did you get your problem with your left shoulder?" and stuff, that kind of thing. And I'm not very good at that. I'm better at hands-on. But anyway, so he was largely self-taught, but he did then sort of do, I wouldn't call him a formal apprentice, but he palled up with various sort of what was called in Australia as then, I think, bone crunchers. And a lot of those bone crunchers were basically called osteopaths, because osteopaths was an unregulated profession then. So he teamed up with people who were manipulating people, chiropractors and massage therapists and sports massage therapists. He ended up actually working with quite a well-known massage and sports therapist who worked with some of the Olympic teams there in Australia. And he learned a lot from him.
What years are we speaking?
God, I don't know. He died in 1982, I think. So, and I guess this was probably in the 50s and 60s, maybe.
Yep.
But I'm not entirely sure. But anyway, so he did a lot of kind of informal working with them and learning from them in his own way. But there's a lot of kind of myth around what he studied. Some people think, he studied with the Aborigines and he learned a lot from them. Or he studied a lot about Chinese medicine, because there seems to be some elements of kind of Chinese medicine and shiatsu and things within Bowen, but it's very difficult to know how much he knew about meridians and that kind of thing. So a lot of it we don't know. A lot of it's speculation. Mm-hmm. We know a little bit about his history, And but it's pretty clear that, so he learned a lot from these people, and he was very interested in things like osteopathy, because you can see from a lot of the way that Bowen works is there's quite a lot of overlap with things like osteopathy and cranial osteopathy, for example. Some of the understandings of the body and around what we now call fascia, I think probably comes from that. So I guess he probably had some kind of working relationship with some of those people. But it also appears that at some point he had some sort of, I would say, an inspiration. I mean, he called his work a gift from God, actually, because he was quite religious. His family were quite into the Salvation Army. I mean, his sister, I think, was, and his wife was, as far as I understand. I don't know how much he was, but certainly he was quite religious in his own way. So, and it's clear that he had some sort of, I don't know whether you call it a eureka moment or whatever you do, but it's funny because a lot of these kind of people who kind of invent therapies or start therapies, like even with osteopathy, seem to have these kind of moments when things come to them and they realize certain ways of working, which are kind of very, very different to the way that other people have been working before. So the way he started working then was very, very different. It was very interesting, which is now how we work, where he would, do a little bit and very, very gentle compared to what other people would have been doing in terms of like really getting in there and moving things around and, bone crunching, as it were, right?
Yeah.
So his approach was much more working with the connective tissue, which is actually very interesting because that's what the origin of osteopathy was like, really, when Dr. Still, who invented osteopathy, 100 years before that or whatever, his approach was all around the connective tissue and all around the fascia and creating more movement and hydration and fluid flow in the fascia. And that's kind of what Bowen was doing as well. But where he got that information from, I don't know.
So what, if we pause a sec on osteopathy?
Sure.
So has it changed since? Do we look at osteopathy different than we did when it was invented?
Well, as with any profession, and it's the same with Bowen, the same with osteopathy, there's different practitioners have different approaches to it, and cranial osteopathy is the same. So some people are more sort of mechanical based, you could say. Some people I know are more energy based. They work more energetically with the body. So it varies a lot. I wouldn't, everything evolves. Bowen evolves over the years. Osteopathy evolves over the years. But certainly the origin of it and the way the doctor Still worked with osteopathy was really focusing on the fascia and working with the connective tissue in the body. And he talked about it in kind of religious terms. He used to say, what's the phrase? He used to say, the soul of man with all the living waters dwells in the fascia of the body, something like that. So he was very spiritual. And it's interesting when you look back at the history of a lot of these kind of inventors of these therapies. I mean, I'm not talking about Bowen now because we don't really know, but a lot of the older ones, if you go back to like the, 18th century even, a lot of them were interested in how does spirit express itself through the form of the body. I mean, even to the extent there was a famous anatomist who traveled from, called Swedenborg, who traveled from his home country to Italy in order to study anatomy. This was in the 18th century. He went to Italy to study fascia, to study anatomy, in order to find out where exactly the soul dwells in the body, which was really fascinating. So I think when we look back at the history of things like osteopathy, they talk a lot about it from almost a religious and a spiritual point of view. I mean, a lot of the language of osteopathy, and particularly cranial osteopathy, is around, they use phrases like the breath of life. That phrase in the Old Testament where God breathes life into dust, and the breath of life becomes form, and the form of that is man. So, they talked a lot about that, and so they were very interested in that. Now, Tom Bowen, I have no idea how he felt about that kind of thing, but certainly the way he viewed it, his phrase was that he felt this was a gift from God. So,
are you religious at all?
I'm not. I wouldn't call myself particularly religious. I would say I'm spiritual, because actually my interest in this work actually derived from, I would say, my experience, or I would call it a spiritual experience really, but it was a very physical experience of the effect of deep stillness through meditation, yoga really, but particularly meditation, on my physical and mental well-being. And in fact, that's why I got into this work, which is a bit of an accident, because I was looking for something which kind of was the nearest thing to meditation that I could find in terms of body work.
In terms of being treated, though, by someone?
Yes, I used to go to therapists a lot, and I started with craniosacral work. And certainly my experience of craniosacral work at that time was like this ability to drop down, which I also like with Bowen as well, is this ability to drop down into the body, into these areas of deep stillness. Because in my own system, I found that was a really great way of being able to integrate what was going on. I mean, I was a real mess in my teens. You know, I was looking for all kinds of things because I was in such a mess. And so it was
like most people.
Well, I don't know about you, Danny. Maybe you seem pretty together. But yes, I guess a lot of us in our teens were seeking for something, right?
Yeah. So what led you to meditation?
Oh, that's another story. Okay.
No, but because the meditation you're saying gave you that experience, which led you to feel something similar in other
but that's kind of what I was looking for, was how can you translate this effect into body work, because I could see the beneficial effect for myself, you see. And it wasn't just the kind of spiritual side of it, which was, you know, connection with the divine and all that, which is very, very powerful, but it was more also equally a connection with the body and allowing my nervous system to kind of settle, which actually was very, very healing. So that was what I was after. And then, so that's why I found craniosacral work, which has a very powerful effect like that. And then Bowen came along kind of accidentally, really, but I found it had a very kind of almost similar effect about bringing people back and bringing you back into the body, into present time. But your question was about spirituality, right? And what was that?
If you're religious. No, only because, you know, like we spoke about Tom Bowen, about it being like a eureka moment.
Yeah.
Which I think I can relate to, and I think if people pause and stop for a second, they probably can also. Maybe I didn't have a eureka moment as grandiose as inventing a therapy that can help people, but bits of, you know, when you learn something about yourself, when it just clicks.
Yeah.
Like, you know, you could do yoga practice for months, and it just, a certain movement just doesn't make sense.
Yeah.
But then you show up one day and you have this mini eureka moment where you figure out something about how your body moves, how it works, how it responds to certain things.
Yes, I mean, a lot of people have had that. I mean,
but
a lot of inventors. I mean, someone like Einstein talks about it, doesn't he? How he was solving, you know, equations and stuff, and then getting these insights and eureka moments and stuff like that. So
you were a music teacher too, no?
Well, that's right. Yeah, I studied music
before the Bowen days.
Yeah, you know, I studied music at university. So yes, I was. Yeah, that's a whole other story. That, I mean, I find vibration very, very interesting. And I mean, some people talk about things like Bowen as almost like, you know, or when you're with doing craniosacral work, it's almost like you're listening to an orchestra. When you put your hands on someone's body, there's so much you can feel. And so part of the art of what we're doing, I think, is like, you know, really kind of sitting back and kind of listening to the whole thing rather than focusing too much on a part. But yeah, I find the whole thing about vibration very interesting, and particularly around what's happening nowadays. This might be a slightly off topic, but it's got a bit of a passion of mine, really.
Yeah.
So because I got involved with playing old instruments quite early on I'm a flautist. And when I was at university, we had this museum of old instruments and these amazing old 18th century flutes and things, which were basically just a bit of wood or sometimes ivory or whatever they were made of. There was even a glass flute there actually as well. But it was quite simple. It was a cylinder as a head joint, and then a kind of tapered body, and just one key at the end. But anyway, and I got really interested in old ways of playing and old kind of scales, which we've lost now. So in the old days, you didn't have the harmonies were quite simple. You had plain chant, and then you had polyphony, but the harmonies were quite simple, you could say, and they were based around certain keys. So those instruments were designed more to play in certain keys, where they were completely in line with the harmonic series. So with the harmonic series, you have you play a note, for example, on a flute or a violin or something like that, and then if you overblow on a flute, so you blow a bit harder, you get well, hopefully not like that.
When I tried it, they made us all in Israel play the flute in second grade for 1 year. I know. Do you have one with you?
No,
I don't. Carry on. Sorry.
But anyway,
when you play it too
yeah,
hard.
well, no, it's interesting because it's sort of like, I think a lot of people don't know how what we listen to these days is a bit of a bastardization of what's real, to be honest. Because when you hear something which is completely aligned with the pure harmonic series, it sounds very, very different. And in my opinion, actually has a much deeper healing effect on people. But anyway, so if you take a note and then you overblow, like you just did with your flute, you get an octave above. And if you overblow that again, you get a fifth. And you overblow, you get a fourth. And then you get a major third and you get a minor third. So the intervals diminish. So those vibrations are like twice as fast each time. So that they're completely in line with the harmonic series, right? The natural laws of vibration, you could say. So if you do that on a violin or any stringed instrument, that's what will happen. But nowadays, you have this situation, because we want to play in so many different keys, and it gets more complex. What happened, maybe, I don't know how many years ago, 200 or 300 years ago, we started adapting keyboards so that they could play in any key. But what that meant was that they shifted from a pure harmonic series. I mean, you have some old organs in Germany still, in churches, which can basically, they're still based on what they call mean tone, which is this pure harmonic series. But they can only play in about 2 keys, otherwise they sound absolutely horrible. So, but the effect is very interesting, and you get that effect that still these days, you get that effect with what we call a cappella music, which is like pure music that is unaccompanied, like a church music, or in some like string quartets where they naturally will play it like that, or in some string orchestras. But mostly with pianos, keyboards these days, with other wind instruments like trumpets and flutes, they're all adapted. But we've got so used to that now that actually we don't notice it anymore. And it's very interesting. When you go, I went to an Indian classical concert a couple of days ago. And again, the way they're playing is absolutely, mostly, unless they're playing keyboards and stuff, they're mostly completely in line with the natural harmonic laws. And I firmly believe that has a very different effect on me. Because I remember coming out of that concert the other day and I felt absolutely wonderful as a result of being bombarded with that intense relationship to those harmonic series notes. So anyway, that's a kind of by the by, really.
There's also there is a lot of people studying the connection between sound and healing.
Yeah.
Have you attended a class, seen it?
No, I'd love to. I'd love to. And of course, you have things like sound
bowls as well.
Bowls and all that. I mean, people love that kind of stuff.
Yeah,
I've been to a little bit, but no, I've never studied. I'd love to study it. Absolutely.
Yeah, it's super cool stuff. Oh, yeah. So we can get back to the music thing, to the music teacher. So I was asking you also about meditation. So you're discovering this meditative state. But how long did it take you? Because also meditation is like, it's a intense process.
Yeah, well,
it requires discipline.
Yeah, okay. Well, in my case, that wasn't quite true. I'll tell you a little bit of a story. So So what happened in my early teens? I had a couple of, I would call them fairly major crises in my family, really, and that put me into, I would say, a pretty traumatized state. I mean, at that time, I had no idea what was going on, but I kind of went into what I now know is a kind of shutdown state. I having studied my autonomic nervous system for many, many years, I kind of understand it a bit. And so that kind of shutdown state is part of our, what we call our old vagus, where you kind of go, you completely shut down. And I didn't really feel my body at all. I functioned reasonably well, but I pretty much stopped speaking, stopped wanting to relate to people, felt very isolated. It was not a very nice time. And I knew that I had to find some way out of it. And I thought at that time therapy would be a good thing to get into. And by chance, I read this book, which I found in a secondhand bookshop in Winchester when I was about 17, 18, I think. It was called The Primal Scream. And it was the first book, it was by Arthur Janov. And it was the first book really that came out that began to look at how trauma is stored in the body and how we could work with it. And in those days, people really didn't understand trauma very well. I mean, they understand it much better nowadays. But at that point, it was like, and I read this book and it was like, it sounded absolutely fantastic. And the whole idea was that, you come to a point in your body where you'd feel this kind of primal angst that existed in your body, and you would scream it out and then you'd be fine. And I thought that sounded great. So I wrote to Arthur Janov. He was in California at the time, and where he started the whole thing. And he very kindly wrote back to me, unusually, and he said, "Well, look, you can come out here, but it'll cost you quite a few $1,000s, I guess, to do it." And I didn't. I was a student, so. But he said, "Oh well, there are these guys in London doing it, and why don't you go and see them?" So I went and saw them, and they were living in a squat in Brixton. And Brixton is quite a rough area. It used to be quite a rough area of London. It's quite nice now, but anyway.
It is quite nice.
Yes. And I ended up living in this whole squatted street. It was fantastic. I took a year out of university to do it, and went through a kind of therapeutic process with them, which was very, very interesting, and kind of was my first step onto that whole therapy.
So what did their version of therapy entail?
Well, it basically involved a lot of screaming and shouting and hitting pillows and blaming your mother for everything, right? So it's like the old days of therapy, and they were just like,
Well, so nowadays they always blame the parents, no?
Yeah, that's true. Yeah, moved on a bit, but yes, we always blame our parents, do we? But anyway, the story goes that it was very interesting, but it kind of just, what it did, it just stirred stuff up for me, and it didn't really resolve anything. I just got kind of like, all I could feel was my own pain, and when I looked around, that's all I could see is pain in other people. You know what I mean? It was not very helpful. It was kind of overwhelming. It certainly got me to be in touch with my body. But anyway, and then after that, I sort of by chance, a lot of these things happen by so-called chance, don't they, in our lives? But by chance, I got, my girlfriend at the time was very interested in Gurdjieff. I don't know if you know who Gurdjieff was, but he was a very eccentric, very interesting spiritual teacher who incorporated a lot of Sufi stuff into his work and everything like that. So I got interested in him, and from that, I then got interested in, again, quite by chance, a form of kind of movement meditation, which was called Subud, which you probably also haven't heard of. It was not that well known. But anyway, so I went along to one of these groups in the university town that I was at, not knowing really anything about it, in a fairly agitated state. And the way they do this sort of walking movement meditation was that they would do some sort of little ceremony, as like a prayer, and this guy stood up in front of me and just read this thing off a sheet, and I thought it was very sweet. But anyway, what happened then was very interesting in the sense that my mind completely stopped, absolutely dead, and it had never ever stopped in my life. It was like someone had a switch, And they went ding like this, and my mind went completely blank. I mean, in a good way. I was still lucid, but there was no thoughts at all. And then I began to move. And quite spontaneously, I did these sort of like circling movements, a bit like a dervish, the whirling dervishes would do. I didn't know anything about dervishes at that time. But I found that very interesting. And during this whole process, there was absolutely no thought at all. And I remember after it, getting on my bike and riding back to my digs, and there was still no thought. And I just thought, well, that's very, very interesting. And then after that, there's a bit of a long story, but I'll get there in a minute. After that, one of my best friends at university had just been out to India to meet this quite well-known guru figure out there. And he said, look, it's all very well for this kind of movement meditation. Why don't you sit down and try this? And he gave me this mantra. I wasn't very interested in it particularly, but anyway, I said, oh, well, give it a whirl. So I sat down, and as soon as I began repeating this particular mantra, I left my body. So then I was looking down at my body from somewhere up in the ceiling. And again, this sense of completely no thoughts at all, nothing.
And you were sober.
And I was completely sober. But anyway, so you say that meditation has to be difficult, but it wasn't. I mean, I hate to say it, it wasn't actually very difficult for me. But that was not, I would not put any credit down to me for that. It was just happened that way.
Do you remember the mantra?
I do.
Is it just one word?
No, it was quite a well-known Indian mantra actually, which is used a lot. It's Om Namah Shivaya, which means Om, which is the primal sound, Namah Shivaya, which means I bow or I worship my own inner self. Yes.
And in the meditation, you repeat that over and over again to yourself?
Yeah, that's part of the practice. Some people practice it like that. But it was much more of an energetic response. And then, certain things then began to happen. But the main thing was this sense of incredible stillness, which I'd never, ever felt before. And this kind of like deep, 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 deep levels of quiet in my system. And that's kind of what I was looking for, really, because up to then, it just felt my whole system was kind of agitated, and I was trying to find a kind of way home and a way back into my body. So that was the thing. And then finding craniosacral work really was something which I felt, oh, okay, so this is a way in for other people who, maybe they don't want to go through the meditation route. As you said, it can be quite difficult for people. That this is a way in for people to experience these kind of states of stillness without all the hard work, right?
So what is it? Is it like assisted meditation?
Well, it is in a way. I often describe it. I mean, with the craniosacral work, when you're just holding someone's head or their feet or their sacrum, whatever, and you're just sinking into this stillness, and it's like it often feels like a journey together with somebody into stillness. I mean, this is my experience. It's not everyone's own experience of it or how they would like to practice. It's just my preference. But people love it. And, so it's like you're just holding their head and you're just encouraging them to drop down into stillness and drop down and see how far can you go into this? How far? It's like a journey, and you can really feel that. It's like you can feel them dropping down, their system dropping down. And it's very, very beautiful, I think. And the same thing happens with Bowen, but with Bowen, we've got less contact. So to be honest, I feel it in myself, but I feel it less when I'm working on people. But the result is very similar.
So can we describe, in brief, a regular Bowen session? Someone, I walk into you. I can use myself as an example. I walk in, I have some elbow pain, some golfer's elbow-ish, and I have some calf pain.
Right.
And I find a Bowen therapist. And
yes, you would.
So what does the process look like?
Yes, I mean, the thing is, you'd normally go to a Bowen therapist for that kind of thing. You wouldn't normally go to a Bowen therapist for, you wouldn't say, can I have a bit of stillness in my life? That's the effect. So yes, normally, I mean, I'm a bit of eccentric in the way I approach this stuff. But so normally you go to a bone therapist because you want something sorted out on a musculoskeletal level. So you've got a frozen shoulder, or you've got a painful elbow, or whatever it is, like your thigh or something. So the process would be that, I would, or the bone therapist would talk to the person about their expectations, what they want, like what we've been doing over these 2 days, do a little assessment about what might be going on. Because if someone comes in with a shoulder problem, it could be related to, an old accident or an old operation, maybe lower in their back, or it could be related to their neck. There's all kinds of stuff that it might be going on. So we're trying to find out what is the root cause of whatever they've got going on, and then explain to them what we think is going on. We're not diagnosing, but what we think is going on. And then we will say what we're going to do. So, and then lie them down and do the treatment. So the treatment involves quite often a whole body treatment. Not always. Sometimes it's more specific around certain areas, but often it's a whole body thing.
So regardless of where I'm feeling that discomfort or pain, then it's a full body treatment?
Not always. It depends, kind of like on a first treatment. What we tend to do is we tend to like to work the whole body first, because there can be stuff going on that people don't tell you. Very often what happens is, like, they come back the next week and they say, oh, I forgot to tell you, I had this pain in my neck, and after what you did, it went after that, and I hadn't even told you about it. And that might be related to something else that they've got going on. So almost
like a body scan for the first session.
Yeah, it gets them used to the work as well, because it's a bit strange having a bone session for the first time when you're just have a little bit done here, and then you wait, and then you do a little bit more. People are not quite used to that, right? So, and the body's not used to it. So it gets the body kind of used to it, gets it accepting the work, but it also is really important to address the whole system. So generally speaking, not always, but generally speaking, on the first treatment, we'll do more of a whole body session. And then on subsequent treatments, we might then hone in more on certain areas, depending. But we're not too procedural. We really have to look at the bigger picture of why someone has something going on. So like with back pain, which is very, very common, that could be a postural issue. It could be an issue with pelvic alignment. But it could be something like head forward posture, which is like endemic in, probably not in Israel.
No, it is. I think it is. It's getting there. It's getting there.
It's like everyone's at their computer,
Yeah.
And I also have a theory about that a lot of these days, a lot of babies, they spend too much time on their backs and less time on their tummies. So when babies are on their tummies, when they're quite young, they tend to push back and open up the chest and push their scapula back. And it's quite interesting when you look at so many, what I would call young people, including you, Danny. I refer to you as young compared to me. But, people in their, teens and 30s even, who went through this whole thing about the fact that babies shouldn't sleep on their fronts, and because of SID, sudden infant death syndrome, was the feeling, and partly because of that, but partly because babies spend so much time in car seats and things like that. They spend too much time on their backs, and so they don't do this whole thing about pushing up, and that doesn't that it affects their development. It affects their breathing, but particularly the shoulders and the scapula. So you'd often see that with younger people, they have this what we call winged scapula, tight here, which always also contributes to this kind of forward posture. But those kind of forward postures then put a lot of strain on the lower back, and it affects the breathing and, all kinds of stuff. Has a lot of ramifications. So that's kind of why we want to work more generally, first of all. Yeah.
I like the fact that it does approach every client or patient as looking at the bigger picture.
Yeah.
So you're not just there to solve a symptom that you're seeing.
No. I think we need to get away from the symptom-led approach of treating people, and obviously a lot of Western medicine is focused on that, isn't it? If you go to a consultant, often they'll do an X-ray or a scan, and they'll say, "Oh, you've got this disc here, which is bulging, that's pressing on the nerve. And so we'll just shave the disc a bit and you'll be fine. And often, sometimes that might work, but often it doesn't. And they're not really looking at the picture, or why, what's happening with your pelvis that's creating that strain on that area of the back, or the tension in that musculature that's creating that situation where a disc might do that. And that often happens because of postural irregularities, or, irregularities and imbalances in the pelvis, which then put a strain on muscles like the psoas or whatever it is, and then creates a situation where that's more likely to happen. So we tend to look broader, yeah.
Does it frustrate the patient sometimes that you just focus on solving the symptom and you want to dig deeper?
Oh, well, no, not at all. No, because a lot of people that we see, I suppose, they will have gone from person to person and
searching for a solution.
I suppose because Bowen is not that well known, they've probably tried other things. They've been to their chiropractor and osteopath and their consultant. Not always. It's not always like that, because actually now I'm quite well known and people come to me because they know that it works, But in some cases you might get that. So they come in and you do your little assessment, which to be honest is really not rocket science. I mean, you've seen it. It's pretty straightforward. And they will often say, oh my God, nobody's actually done that with me before. I mean, I know that osteopaths will do that kind of thing, but typically consultants perhaps won't, or their doctors won't do much of a physical examination.
Yeah.
And when you point out to them, well, I'm not really surprised you've got that problem with it, because, your pelvis is doing this, it's forward on the right, and, okay, what are you doing in your work that's creating this? And you ask all those kind of questions, and you try and get to the root of it. So they like it.
I modeled for a walking assessment.
Ah, you did.
So looking at my hips, right?
Yes.
And you had me put my hands on my
yes, on your iliac crest.
On my iliac crest.
Yes.
And then you said that's the best positioning for you to kind of analyze and assess the movement of the hips.
Yeah, well, if you do that, you can kind of see as people walk, you can see the kind of up and down movement of the hips when they walk. So it's a bit easier. I mean, you can see it without, but it's a little bit easier when you.
Yeah. And you said that I had some deficiency on the right side.
Well, I would never call it deficiency, don't I?
Small problem.
I mean, we're very careful with language. No, but actually, it's very important. That language is so important when we're giving feedback to people. I mean, I know that in some surgeons, when they're doing operations and stuff, are very, very cautious, particularly when people are under anesthetic, because things that they say go in very, very deep to their unconscious, and can affect people, quite strongly. So we're very careful about what we say. So If I would never call it, I don't know what word you use now, some deficiency, right? Yes, and I would never say that. I would say that.
Yeah, but you can be honest with me, John.
Yes, but if you were my client, I'd be careful what I'd say to you. There was a wonderful story when I was teaching in Germany recently. There was an anaesthetist on the course there, and she was saying what happened to. It was quite a funny story. What happened to someone in her hospital when she was teaching in, I think she was working in Australia. But anyway, this woman came out of surgery. I think it was for a hysterectomy or something. And the whole thing had gone well. The operation had gone well. She was on good course for recovery. And as she left the hospital, there was an Australian with quite a broad accent. And he was discharging her, and as he was discharging her, she said to her, and I'll excuse my Australian accent. He said, "Okay, Mrs. Smith, you can go home to die." So she took that internally. She took that as, "I'm going home to die." Well, he meant going home today, right? So
that was a pretty good Australian accent.
Oh, thank you.
Great.
I'm going home to die, mate. Anyway, but this is a true story, and that's what her subconscious heard. And she went home and she began to deteriorate quite quickly, apparently. Anyway, they got her back in. They couldn't quite work out what had happened.
Yeah.
They got a hypnotherapist in to try and kind of find it out. And then they tracked it back to this, that's been said. But anyway, it's a funny story. But we have to be careful. So we tend not to use negative terms, right?
Yeah.
So when we're describing something, I know some massage therapy, you go to a massage therapist and they'll say, oh my God, I've never seen such a tight back in all my life. It doesn't make you feel very good, right? Does it? So the way I would couch that, I would say, well, there's a little bit to work on there, Danny, in the way you're walking. And I would say there's a little bit of restriction around your right sacroiliac joint, which is what was happening actually with you.
So is it restriction?
Yes. Yes, and that could come from too much sitting or lifting something. I don't know what you've been doing recently or working out or you go jogging, right? Okay. Have you had
running?
Running. Okay.
Don't insult me.
Running. And you run along the beach in Tel Aviv, right?
I do. Yeah.
Okay, cool. And have you ever fallen over or?
No.
No.
But again, I've had some.
So have you noticed something with your gait, a bit different left and right?
No.
Oh, okay.
Nothing new. Like I think
so you've had this for a while, right? Okay.
Little problem that I have. I think it's been for a while, but I don't think it's
no.
So
you would have compensated and adapted for it. Yeah.
I think I've adapted to whatever it is because I feel okay.
Yeah.
Nothing out of the ordinary, but is it easy to spot? I'm assuming.
Well, yeah. So basically, what we were looking at there when we're getting people to do that, and basically, what happens when you walk, all the joints in your body are moving, and that includes the sacroiliac joint, which is where the bottom of the sacrum, the bottom of your spine, right, sits like a wedge shape within your pelvis, the rest of your pelvis, the left and the right iliac bones, which is your pelvis. Now, if you look at a four-legged animal, they've got a similar construction to us. They've got a spine, and they've got the sacrum, and they've got their legs, back legs. So for a dog or something like that, their sacroiliac joint moves a lot, and they wag their tail, and it's all hunky-dory. But also, there's not too much pressure on their sacroiliac joint because most of their weight is through their front legs. But when we go to a standing up position, it's like all our weight of our upper body is held within our sacroiliac joints, and it's kind of suspended with these really, really strong kind of ligaments, yeah? But anyway, it's designed to move. So if it doesn't move, then it's like the whole pelvis has to move to compensate for it. So that's what we're looking for. So when you were walking, I think your left side was fairly level, but on your right, it was kind of lifting up a little bit and swinging forward. And the other thing that you can see with this is like when the heel goes down, the heel strike, you see this kind of jarring through that side. So it wasn't that obvious. It wasn't that bad at all, Danny, so don't worry about it. But it was I could see it a little bit. So it was a bit of a lift through your right ilium as you walked, a bit of a coming forward, and as you put your heel strike down, it went doing a little bit like that.
And then, so if I came to you as a patient,
I
hope we can talk about these things. If I came to you as a patient, then what would the process be like? What type of treatments would we do in order to correct this?
Okay, so
are we trying to correct it? Or are we trying to, because you mentioned a lot about restoring movement and hydration, mobility to the entire body and hoping that it fixes itself? Or are we honing on a specific area?
Hoping it fixes itself. It will fix itself. No, I mean, we're giving it the opportunity to fix itself, but it also depends what you're doing, So if someone's sitting a lot, and that's not going to help. So part of what Bowen used to encourage people to do was to walking. I mean, things like walking are very, very important for movement. But so what we would do, we'd do these kind of assessments with you, and then we'll do some work around the sacrum, and that specific work that we were doing yesterday and today is designed to when we move over ligaments and fascia and tendons like that, it's designed to bring more hydration into the area. So basically, it will begin to release the sacroiliac joint, create more space in it. So that's what you're saying about we're hoping that the body will heal, but actually, it's giving the body the opportunity to heal because it's creating more hydration in it. It's creating more space in the joint. It's restoring the integrity of the tissues, if you like. Yeah. So that's the plan.
and then, let's say I understand that you're saying that I could be maybe damaging myself or maybe disrupting the healing process by maybe sitting for too long, by maybe restricting the ability to heal myself.
Lack of movement creates a lot of kind of confusion. I was going to say a lot of kind of stagnation in the tissue. I mean, our tissues are like full of fluids, and these fluids are quite sticky. They are in size, they call them glycoaminoglycans. They're kind of like sugars, proteins of sugars, and so they can become sticky, and that you need that kind of fluidity in the various layers of all the muscles and the fascia, etc., to be able to move quite freely in the body. So that's kind of what we're restoring. It's a bit like if you had, when you were a student, you had a coffee cup, and probably used to drink lots of sweet coffee and stuff, right? So, and you left a coffee cup on the side in the heat in Tel Aviv, and when you come back, and then the coffee cup is kind of stuck to the saucer, because it's dried out, it's become very sticky.
So would it be something that I keep returning to keep, fixing not fixing, but allowing my body to keep healing itself in the best way possible? And is it healing like a one and done thing, or is it a continuous thing until I perish?
Well, that's it's a difficult question to answer. It depends kind of what you do. But in my experience with Bowen, people usually come in with an issue. And I would say mostly within 3 or 4 sessions, things have changed quite substantially. And unless they're doing something repeatedly that's going to re-injure themselves, things, change. They do change, and they stay that way, unless people do something stupid.
Yeah.
So, I think Bowen has a very, very good track record at kind of long-term effects, to be honest.
So I've experienced craniosacral therapy on myself, which at the time was very tough to understand what was going on, and very tough to connect with, because it wasn't something I sought. It was something recommended to me, almost as a last resort. I had this knee injury that just it wasn't going away.
Right.
I was actually coming back from an ACL surgery.
Yeah.
And the rehab process was not linear at all.
Okay.
And I got to a point, like a ditch, where I just couldn't get out of. I had this had this pain on the surface of my knee that would not go away.
Yeah.
So as a last resort type thing, I was sent to who's known as maybe the crazy athletic trainer at the university that I was playing football, soccer at in America.
Yeah.
And people only send athletes to this crazy guy when it's a last resort.
Okay.
Funny enough, and usually he's able to help.
And he was a craniosacral guy.
This craniosacral guy's been studying it for many, many years. Still claims to, amazing guy, still claims to know nothing. But
it's interesting. Claims to know nothing.
Claims to know nothing about. He says the more he learns, the more he realizes that he's not even close to understanding the body, the energy systems, and all those different things. Now it's way easier for me. It's still difficult, but way easier.
But did it change when you went?
It did.
Oh, and you don't know why.
I don't know why.
But when he was working on it, did you feel stuff moving or changing or energy?
He was guiding me through the process and guiding me through what he was feeling. So I really don't know to tell you then if I was actually feeling it or I was trying to synchronize myself with what he was saying. So it was difficult to. Now I can now I would be way more open-minded and more receptive, and maybe find it more interesting, and I can see now how it maybe can help me.
Right.
Then I don't think I was, but it did help me.
Yeah.
I was like, I went through the sessions, but I did not really understand why I was doing it.
Okay.
So it was a difficult one to see, but it helped. And I had a very good friend of mine that could not get over a headache from a concussion.
Yeah.
And it was chronic.
Yeah.
And also a few craniosacral therapy sessions, which, again, he told me that it made he was crying during the sessions. I don't know if that's something normal or if you have seen that.
Yeah. Yeah, I mean, with the craniosacral work, it's different to Bowen because with the craniosacral work, you have a lot of contact, hands-on contact. you might hold someone's head or their back for like, 10, 15, 20 minutes or something like that.
Yeah.
And after, I've been doing it again for like a long time, 30 years, and you pick up these skills, and it's very difficult to explain really how you do it. So for example, I teach intro courses on craniosacral, but I remember the other day doing a class and just putting my hands on somebody's head like this, and pretty much immediately feeling this line of compression. And it was a very, very specific line. I can't remember the direction, but it was like feeling in my hand like across here or across my palm in like a line. I thought, well, that's very unusual. You don't normally get that kind of thing. It was like the tissues kind of going like this. This kind of what you feel like, if you have a blow, the tissues kind of go like this to hold that kind of pattern. Anyway, it's a very specific angle it was. And
this with you having your hands behind.
Yeah, just under the head. I feel this kind of thing a lot. This wasn't that unusual, but in this case it was a bit odd. And I said to her, "Gosh, it feels to me like you've fallen backwards onto something quite hard, almost like the edge of a step or something like that would have caused that kind of thing." And again, she actually had an emotional reaction at that point. And she said, well, gosh, about 3 weeks ago, I think it was, I fell backwards and I hit my head on the edge of a radiator. So it was this very, very hard edge. And I could feel that. But anyway, working with it is very interesting. And like the way you've explained it, it's kind of difficult to get your head around it on a kind of analytical point of view. From the point of view of craniosacral work, when you put your hands on someone, and I think this is probably true of any kind of therapy, to be honest, but with craniosacral, there's a bit more intention behind it and focus on it. But when you start putting your hands on someone, something happens, and we say this a lot in craniosacral work. Something happens. We don't necessarily know what it is, but the body responds. And the body responds.
And that's the key thing.
Through
right?
the listening.
The body responds.
Yes, through the listening. There's something in the relationship between a therapist listening to the body. We talked about this when we're working with babies, for example. This act of active listening creates a situation where the body has permission to tell its story, you could say. That sounds kind of esoteric, but actually it's very practical. And on a practical level, when you got your hands on someone and you're just listening, and the listening is very interesting. We had this analogy of the orchestra earlier. Like you're just sitting back and just seeing what comes to your hand. And then the body responds. And it actually, in craniosacral work, it responds in very, very specific ways. So you'll get a reaction in the tissues. And very often that will have a certain pattern to it. It'll like eddying under your hand. And then it'll often begin to soften. And there are kind of key, very subtle things that we do in craniosacral work to encourage that. But even if you just listen, it'll happen. And so you get a softening of the tissue and an expansion and a letting go. So there's something that happens in that process through listening, which involves some sort of resolution. But that is very difficult to explain. But I think a lot of therapies that we do, we tend to focus on the technique, if you like, but actually beneath that, there's something happening in the therapeutic relationship which is really powerful. And I know a lot of the whole placebo effect has been studied, hasn't it? A lot, which is just that fact of someone paying attention to you or telling you things can have a very powerful effect on your body.
Learning craniosacral therapy, is a lot of it come with experience? Because I can imagine it being very difficult to connect, understand, feel early on, or am I completely wrong?
No, I run 2-day courses, like intro courses, mostly for other therapists. So they're a little bit used to putting their hands on people. But having said that, I've had people who've never had any experience at all. And it's quite amazing. I think it's a lot of what we do is actually just paying attention to something that people can actually feel, but they just never really paid attention to it. It's like if you were learning plumbing or something like that, and you paid attention to, you put your hand on a wall, and you could probably feel if there was a pipe there with running water. You've just never done it before, right? So it's like that. You're putting your hands on someone's head, and you think, oh, that's interesting. I never felt that. Well, they've never done it, right? And then you begin to put it in a kind of context. Well, oh, that means that. When you're feeling that kind of eddying pattern, oh, that means that, and a way of working with it is that. So I find actually these little intro courses on craniosacral, they're absolutely mind-blowing, the things that people can feel. So I think it's just being open to it and just actually listening, really. Yeah.
You mentioned babies.
Babies,
I have to ask you about that. Yeah, it's your passion. Why? Yes. Why is working with babies, mothers, your passion?
You
could take a sip first. Sorry.
That's right.
My question wasn't long enough.
Well, I know this is going to require a bit of a long answer, so I need a bit of fluid. Well, again, it came from my own experience, really, that from a kind of therapeutic point of view, I used to actually, to be honest, when I first studied craniosacral therapy, there was beginning to be quite a lot of emphasis in the work around how birth, particularly, affected us long term and created these physical, emotional, psychological patterns in our lives. And I actually thought at that time that it was well overstated. I really didn't take it seriously at all. But then with my experience in therapy, I began to realize, oh my God, yes, I have these patterns, and you could even say belief systems that we bring into this world that were very, very strong, that clearly had their origins in not only a birth experience, but actually a prenatal experience.
We say clearly, though.
Yes, clearly, because your body remembers it. And when you start feeding into it, you can feel those patterns quite clearly. So, for example, you can do work around your umbilical area, and a lot of have issues around that area. And for me, that was very, very, very strong. So, therapeutically working around that area brought up all kinds of stuff for me. But
I can barely touch my belly button. Is that a side effect of?
I'm the same. I find it. I hate being touched there. Or anything like that. Yeah, probably. I mean, I wouldn't like to analyze your prenatal experience, Danny, but I would imagine. I mean, a lot of us didn't have it that easy.
Yeah.
Yeah, we don't want to go too deep right now. But anyway.
Off air.
So I began to actually realize that it was from my own experience and how that was held in the body and things like that. But also how it creates belief systems with us. And I got very interested in how that gets linked in with how our nervous system operates. And that's become much more, trending, you could say, these days, with the whole thing about the vagus and our autonomic nervous system, which is amazing work from the work of Stephen Porges. I'm not sure if you're familiar with that, but it's really amazing. It's a kind of an understanding of how our nervous systems has developed over, hundreds of thousands of years, really, from very, very primitive creatures who kind of lived at the bottom of the ocean and didn't do much and didn't go out much. Which were basically a kind of creature with a digestive tract and able to reproduce, in which the very primitive nervous system began to develop. And we would call that now our old vagus, which is still within us and controls our gut function and all that kind of stuff. And then through the evolution, our sympathetic or our fight or flight response began to develop. And that's a separate kind of part of our autonomic nervous system, which is to do with mobilization and, fighting for things and running away and all that kind of stuff. And then more recently, recently I'm talking about, hundreds of thousands of years ago, the new vagus, so the new nerve pathways to do with social interaction began to emerge. And that's, again, it's all to do with survival, really. So, a lot of creatures, I think about 2/3 of creatures on this planet can survive on their own. But us mammals can't. We need to work together and coordinate together. So this newer part of our nervous system, which we call the new vagus, began to emerge in order for us to survive in groups. So it's a lot to do with how social interaction and the use of our voice and our heart and our breath and all this kind of stuff. So anyway, I got very interested in that from hearing Stephen Porges talk about this about 20 years ago. And I began to realize how those imprints on our nervous system get imprinted very, very early even in the womb, even as our nervous system is beginning to develop. And they can get associated with certain belief systems. So, for example, when a baby experiences something quite traumatic, which it might do at birth, or it might even before birth, or in the first year, the baby will try and understand what's happening. And along with that, there will be a response in the nervous system. So their nervous system might go into a sympathetic activation. And then typically in babies, that's the Moro reflex. They go, you see that babies, they like this and they hold their breath, and that's the Moro reflex. That's a sympathetic activation of the nervous system. They might do that a lot. But also some babies will go into more of a collapse if they have something traumatic happen. They go into a kind of shutdown. They become quite quiet and they lose a bit of muscle tone, and they probably don't feed that well. It's not that great really for babies. But anyway.
Is that the most sensitive periods, before birth and that first year?
Yes, but it can happen with adults. You get this with people in war zones and stuff like that as well, where they go into a complete collapse. That's a kind of part of the old vagus really. But anyway, so we have these kind of reactions, and for most people, they can move in and out of them, and that parts of their nervous system. But what I'm saying is that often a belief around your relationship to others and the world will arise around that time. So at birth, for example, when you're first greeted, your first experience, like we were feeling, and like I did on you, is now with that suction cap on your arm.
Fascinating.
Which is quite painful, right?
Yeah.
I mean, you didn't flinch that much, but I think it was quite
painful. Yeah,
right?
It was.
You can imagine a baby's first experience of the world has this thing put on their head, and it's bloody painful. They think, what is this, right? And that gets associated because they try and work out what is going on. Do I need to pay attention to this? And often babies will sort of reflect that back on themselves as though there must be something wrong with them. Because when they're born, there's a lot of celebration. Everybody's very happy, but their experience was, oh my God, this is awful. There might be some good bits about it, but for many babies, this was pretty, a difficult experience. But everyone is happy, so there's a kind of disconnect. And we were talking about circumcision, yes, which is even more extreme.
Yeah,
where you might have, which is very common in Israel, but it's very common in America, not so common here now.
But different. Well, okay, it's common in America, but in a different format
context.
Completely. Yeah.
Yes. So in the context in somewhere like Israel, where it's a celebration, isn't it? It happened a few days after you're born, right?
8 days, yeah.
8 days, yeah. And everyone's very, very happy, right? Is that right? The family come together, they have a big party, and there you are. And your experience, I'm not talking about you, Danny, because I don't know what happened to you.
You're describing it pretty well.
Okay, sorry. We laugh about it, but it's not very nice.
Maybe that's what makes all Jews alike to some degree, is this experience of 8 days.
Well, that's interesting.
We're similar nervous systems.
Well, yeah, that's a very good point. But just to conclude this a little bit, so I'm talking from your experience, and I don't know what your experience was, and maybe you don't want to remember it. But anyway, but a typical experience would be that pain, and that would happen suddenly. And when things happen suddenly, the nervous system will respond to that really quickly. And the way that our bodies are designed, our nervous system is designed to it, is to respond fast. Right, this is dangerous. I need to respond now. Something needs to change now. So our nervous system's going to this, like this. And then along with that, you'll have this thing, why? There must be something wrong with me. Right, because everyone else is happy, so I'm wrong. So you can often get this kind of, this association between a nervous system response later in life and also then a belief about your relationship to the world or who you are. So I'm not saying this is true of you, but certainly that can happen like that. So I find that very interesting, and I noticed that from my own experience, that I would go into a freeze state, and often along with that there would be an association with it, like a sense of A lot of people have this actually, just a general sense of badness for some reason, and often that will happen from very, very early experience like this. So that's why I'm interested in it, because it's all pervasive. And you were saying, yes, what happens when something like this is experienced by a whole community? And that's very interesting. So, I mean, you get different events happening. So if you were in Brazil, if you're a Brazilian, you almost certainly would have been born through cesarean, because something like 90% of all babies in Brazil are born through cesarean section. If you are born in Bulgaria, you almost would have been separated out from your mother for about 3 days and left in a kind of dormitory with other babies and been visited by maybe your parents for feeding. Now, we used to do that kind of thing here. So for myself, if you're born, say, up to the mid-60s or something here in the UK, you would have been taken away from your mother and you would have been put into one of these places. And, so what we're saying is a whole generation of people will have experienced almost the same thing. So with those kind of issues, there's many, depends how a baby might interpret that, but certainly things like separation at birth definitely have been studied a lot and tends to create anxieties around closeness and relationship and all that kind of thing, and perhaps a sense of worthlessness. So, but I'm not, I don't want to categorize, because everyone will feel that slightly differently, but those are kind of the tendencies that you might see. So, we have to ask the question, if we're talking about Israel, what is the result of that? And, what is the effect on things like sexuality or one's relationship to women, or, and effects on relationship in general? I don't know. I mean, you would know more about what you see. But certainly there will be effects. Yeah.
So, and your work with mothers and babies, and I think an important, very interesting thing you said, is that you believe that if you're working on the mother, you need to work on the baby, and vice versa.
Yeah, because they're, particularly at a young age, up to about 2 or 3 certainly, or even beyond that. But certainly in the first year, they're very much one unit. I mean, we're basically born, at least 9 months too early. I mean, thank God, because you wouldn't want to stay in your mum's womb. Well,
she wouldn't want.
When you're in there, otherwise you would be too big to get out. And it's partly because our heads have grown, through evolution. We just have to get out, and we have to get out about 9 months too early. So what that does is creates a situation where the baby unusually, unlike other mammals really, is completely tuned in to mum for survival. So it's like baby's awareness is very much out there. It's like they're out there, and they will often, really look to mum's well-being above their own. They'll actually prioritize mum's well-being above their own sometimes. So because that's their survival mechanism. So it's like we have to work with them both. They're like one thing, really, and very important. And we don't want to blame the mum either. New mums have got so much on their plate. The last thing you want to say is, your baby's struggling because you're so stressed. That doesn't help anybody, right? But we can offer some very, very gentle support, and again, just listen to what mum's been through, because it probably wasn't that easy for most mums.
But when you do work with mothers and babies, it's not necessarily to treat a musculoskeletal injury.
Oh yeah, it can be, because mums can be a lot of pain if they has a cesarean section. That's pretty debilitating for a few weeks after giving birth. But a lot of mums have pelvic imbalances. They have pubic symphysis pain. They can have sciatic pain during pregnancy, after birth.
Also, do you work with them also during pregnancy?
Yeah.
Is that part of the passion?
No, absolutely. I think it's really wonderful to work with mums during pregnancy. Yeah. And you can work with them in lots of different ways. A lot of things is around creating positivity, empowerment, because I think what's happened over the last few years has been very interesting in the sense that people have lost a lot of trust in their own natural processes and their bodies to do stuff. But this happened a lot with COVID, in the sense that people it kind of felt that their bodies weren't safe anymore, and that other people's bodies weren't safe anymore. You know what I mean? That this whole message was that our bodies are not capable of fighting something off. And of course, with COVID, we had also this whole thing about lack of connection. We couldn't see people's faces, and that had a big effect on our nervous systems as well in terms of isolation. But I think this thing about, I'm kind of passionate really about reconnection, and so and a lot of this Bowen does really. It's like, how do we reconnect with the safety of our own bodies? How can we feel our bodies as a nurturing and safe space? And it's the same thing with how can we connect with each other. Traditionally, if you look at how traditional people have healed themselves, it's always been through feeling and establishing a connection, a reconnection. So with their bodies, with the earth, with spirit, with each other. And a lot of what's happened over the whole COVID thing, and with the whole climate change thing as well, is that people have lost that connection with the earth because the earth is seen now as something that, for a lot of people, feel that we've damaged it somehow. So that reconnecting with the earth can feel a kind of like a two-edged thing. Like there's a need to do it, but it's also painful. And that's very, very sad, because we've always done that in the past. And this need to reconnect is so important. The need to reconnect with bodies, with our earth, with each other, and I'd say with spirit. And I actually firmly believe that these kind of therapies like craniosacral therapy and the Bowen technique really help us to do that. And I think it's really crucial at this time that we allow that to happen.
Super interesting stuff. Look, I just for time purposes, we have to wrap this up, unfortunately.
Okay. Oh, that's fine. No problem.
But it really is. Put it on the camera. So this is
my little booklet,
the little booklet, but you've written a couple books, right?
Yes.
You do live classes, you have online classes, you have online classes also with us at NAT.
Sure.
So yeah, or Instagram, Facebook, you said. Please tell the listeners where they can find information about you, about your classes, and about what you do.
Yeah.
Please.
Yeah, no, so yes, I've written a few books. So I've written those little booklets, which have been translated into lots of different languages, which are kind of like for the general public. And then I've written 2 other books on Bowen, The Inside Story, and using the Bowen technique for complex and chronic conditions is another one. And I've also written 2 big books on working with mums and babies. There's one that's called Choices in Pregnancy and Childbirth, which I'm really proud of, actually. And it's around all the kind of choices that mums have to make around, food and environmental aspects and all the things that can be really important in pregnancy, and the choices around childbirth as well. And, it's, I think it's a wonderful book. But and then I've also done another one. I edited that one about ways of working. So it's called An Integrative Approach to Treating Babies and Children, which I edited and worked with a number of pre and perinatal educators around. And I run 2 platforms, online platforms. So one for therapists called ehealthlearning.tv, and the other one is called ourbirthjourney.com, which is for initially for therapists working with mums and babies. We're actually opening that out now for families who are interested in this kind of material I've been talking about. So please have a look. So that's ehealthlearning.tv and ourbirthjourney.com.
Phenomenal.
Good.
So, Mr. John Wilkes, thank you so much. It was a pleasure being with you here to record this episode. Also, the last couple of days, I learned a lot from you. So, thank you very much.
Oh, thanks, Danny. And thank you, Craig.
If you liked this video and you want to see more, make sure to subscribe below and don't forget to hit the notification button.